Okay, this is video 2 of Respiratory Therapy Science 2, Unit 5, going on with arterial blood gas draws. So now I'm going to explain the procedure on how to do the draw. We'll also go over the Allen test. There is an extra video in the Unit 5 under the content section that does show a video of doing an Allen's test if you want to watch that. And then I also would advise you to practice on somebody in your house if you have someone that's willing to practice the Allen test with you. All right, so we'll move on to the procedure of drawing a blood gas. So you'll want to enter the room, wash your hands, introduce yourself and your department, make sure you check the patient's name band and explain the procedure in words that they can understand. So don't tell them I'm here to draw an arterial blood gas. I would say something like I'm here to draw some blood. We're going to draw it out of the wrist area, see if they've had this done before. And then you want to just make sure you gain the patient's confidence so that there's full cooperation. You don't want to tell them, hey, this is my first blood gas draw and I'm really nervous. Just go in there, confidently, and you'll probably be fine with getting their cooperation. Make sure you verify the oxygen concentration. If it's incorrect, adjust the oxygen level and wait 15 to 20 minutes before you draw it again. So if the patient was supposed to be on 1 liter per minute of oxygen and you walk in and they're on 6 liters per minute, go ahead and adjust it, and then we can draw the arterial blood gas in about 15 or 20 minutes. You want to make sure that you wear gloves. Put the patient in semi-Fowler's position. And with the patient supine, their PaO2 will decrease somewhat because the abdominal contents compress the diaphragm. So if you can get them to sit up, that's even better. If you can get them to sit up and kind of put their feet over the side of the bed and get a bedside table, that's even a better way to draw in it, a little bit easier for you to get the arterial blood gas. So some site choices, these go from most to least favorable. So if at all possible, we try to draw blood out of the radial artery. If that's not possible, then we will go to the brachial artery, will be our next choice, which is up by on the opposite side of the elbow. Dorsalis pedis would be our third choice, and again, that's on the top of the foot. And femoral artery is our last choice. So select your puncture site, and then you're going to feel both wrists and figure out which one you find the best pulse in. Just because somebody else drew it on the patient's right arm doesn't mean that you have to draw it on their right arm. You can feel both of their pulses and then decide which one you feel the best pulse in. If the radial site is selected, you do need to do a modified Allen test, and that's performed to ensure that there's adequate collateral flow in case the artery should become clotted because of the procedure. So really the test is used to perform to see if the ulnar artery has good blood flow to the hand. So if something would happen to that radial artery, you still have the ulnar artery supplying blood flow to that hand. And again, if you go in the content section of Brightspace and go under Unit 5, there is a video of me performing the Allen's test to show you how that's done. You should perform the Allen's test before you draw the blood gas and after you draw the blood gas. If the patient is comatose, you can milk the hand to make the hand turn that whitish color to get the blood flow out of the hand. So you ask the patient to form a tightly closed fist and force most of the blood flow from the hand. Pressure is then applied to the wrist to compress both the radial and ulnar arteries. Then have the patient open his or her hand and release pressure over the ulnar artery. So the ulnar artery is going to be on the patient's pinky side. The radial artery is on the patient's thumb side. And then flushing of the palm should occur within 10 to 15 seconds. So after you release the ulnar artery, you should see the hand turn back to that pinkish color, and that should happen within 10 to 15 seconds. If flushing does occur within 10 to 15 seconds, this is called a positive Allen's test and proves that the ulnar artery has adequate circulation to the hand and the puncture is safe to perform. If flushing does not occur within 15 seconds of the release of the ulnar artery, the circulation is inadequate and another site must be evaluated for the puncture. For the dorsalis pedis artery site, you want to press down on the dorsalis pedis artery, which is on top of the foot, and then press the nail of the great toe so that it blanches, which means it turns white. And then release pressure on the toe and watch for a rapid return of color. This is a positive test, and confirms blood flow through the posterior tibial and lateral plantar arteries. A slow return of blood flow indicates poor circulation, and then another site should be chosen for this. Preparing the puncture site, if a radial or brachial site is selected, the joint should be hyperextended with a folded towel to help stabilize it. So if you have the patient on the side of the bed with their hand on like a bedside table, and then if you put kind of a folded towel or some sort of bracing device under that to hyperextend that wrist, it does help to find the pulse and to get a good stick. Then you want to clean the site by wiping it with alcohol or iodine. Most places are just using the alcohol wipes. Some prefer to anesthetize the puncture site with a 0.8 to 1 milliliter injection of a 2% lidocaine into the skin and create a wheal. Others believe that this is unnecessary because the injection will cause pain itself. So it depends on hospital policy. Most of the hospitals in this area do not do the lidocaine under the skin. So it's just going to depend on where you work, if that's their hospital policy or if they do not use the lidocaine. Again, most places do not. So drawing the blood sample, you want to hold the syringe just like you would hold your pencil. And the radial and dorsalis pedis artery should be entered at a 45-degree angle. The brachial artery should be entered at a 60-degree angle, and the femoral artery at a 90-degree angle. So you're going to use your first two fingers of your free hand. So if I'm right-handed, I'm going to feel their pulse with my left hand to palpate the pulse, and then hold the artery still. Do not compress too hard because then you'll obstruct the blood flow through the artery, and then when you stick the patient, you won't get any blood because you're occluding the artery. So again, with your left hand, if you're right-handed, with your left hand, you're going to feel for the pulse, and then you're going to do the needle stick with your right hand or your dominant hand. The bevel of the needle should be up as it enters the skin. If you ever looked at a needle, one side has an opening in it and one side doesn't. So the beveled end of the needle, which has the opening, needs to be up as it enters the skin. The needle should enter the skin quickly to minimize pain, and then carefully advance the needle into the artery. When you see a pulsatile flow in the needle, then you can stop inserting and the syringe will fill on its own. Because it is an artery, it does have a pulse, and so you don't have to pull the syringe or the plunger back. It will automatically fill. If you're unsuccessful, you withdraw the needle to the skin, but do not take the needle completely out of the skin. Just withdraw it back to the skin, change the angle of the needle, and then reinsert it into the artery. If you take the needle completely out of the skin, just go ahead and throw that needle in the sharps container and get a new needle. It's not worth you risking sticking yourself with a dirty needle. Just go ahead, if you pull that needle all the way out of the skin, go ahead and put it in the sharps container and open a new needle. You want to obtain 0.5 to 1 milliliters of blood before removing the needle. The blood gas machines don't need a ton of blood to get the information that's needed. So even if you just get a small amount of blood in your needle and for some reason the flow stops, go ahead and try to run it through the blood gas machine before you stick the patient again, because you may have enough blood and you don't need to do an unnecessary stick. And then when you're done, you want to pull the needle out quickly and press the sterile gauze onto the puncture site, and you're going to hold that gauze for about 2 to 5 minutes, and then check the site to ensure that clotting has occurred. If clotting has not occurred, go ahead and hold that longer if you need to. And then you want to get any air bubbles out of the needle, so you can kind of flick the needle with your finger and get those air bubbles out. Seal the needle, roll the syringe to mix the heparin, and then place the syringe in ice water. So once you're done drawing the blood gas and you have the recapping mechanism on, just get rid of the needle right away. So then that way there's no risk of puncture. So get rid of the needle, put it in the sharps container, and then kind of roll the syringe around to mix the heparin, and then place the syringe in ice water if that's hospital protocol. But again, not all hospitals use ice water, and you don't need to put it on ice if you're going to run the arterial blood gas right away. If you do not run the blood gas right away, failure to put the blood sample in ice water will result in a decrease in the PaO2 value, an increase in the PaCO2 value, and a decrease in the pH level, and that's because cellular metabolism has started. Some department protocols say to leave the needle unsealed and uncapped to minimize the risk of accidental technician puncture. This is to reduce the risk of spreading hepatitis or AIDS. When you're done with the draw, you want to label the syringe with the patient's name, the oxygen percent, and the patient's temperature if it was abnormal. Some other things you could chart on the patient is the patient's age and the position you had them in while you were drawing the blood gas. Have the sample analyzed as soon as possible. Again, anything over 10 minutes should be iced, but again, you want to go with your hospital protocol. If the railings were up when you got there, make sure that you put the patient back into the position that they were before you drew the ABG and put the bed rails up, wash your hands, and then get the results to the patient's chart. So some things you want to chart after you draw is document the procedure, the date and the time, the site used. So if you use the right radial artery, left radial artery, right brachial artery, things like that. And the Allen's test results that you got, and make sure that you note that if it was a positive or negative test. The length of time that you held pressure, and then the condition of the site pre and post draw. If there are air bubbles left in the syringe when you go to run the blood gas, you will get skewed results. So the pH will be increased, the PaCO2 will drop down towards 0, PaO2 will increase or decrease towards 159 torr, and that's all going to atmospheric pressure. So if you remember, the PiO2 is 159 torr, the PiCO2 is close to 0. And then if it's not iced, again, cellular metabolism will take over, pH will decrease, the PaCO2 will increase, and the oxygen level will also decrease. Some ABG problems. Some other problems include clotting, bleeding, if they're on any anticoagulant therapy such as heparin, Coumadin, or aspirin, and vessel spasm are all problems with arterial blood gases. So this is the video that's embedded in the PowerPoints. So in Brightspace, you are going to need to download the PowerPoints to have access to that video. I will also see if I can just copy the link and put it into the Brightspace that way as well, so you don't have to download the PowerPoint. So I'm going to go ahead and stop this video because we're getting close to the 15 minutes. And I just wanted to make some notes on your calendar. So it says on March 23rd, which is Monday, that there is a quiz. I will open up the quiz on Monday, but I will make the quiz due on Wednesday, March 25th. And then on Wednesday, March 25th, it says Exam 5. I will open up Exam 5 on March 25th, and then I will give you until Monday, March 30th to complete that exam. If you have any questions about this, just go ahead and throw them in the discussion area under the question section, or you can always email me. Once I get these quizzes and exams created in Brightspace, it will automatically kind of go on your calendar in there, and you'll be able to see when they open up and when they're due. Again, if you have any questions, just post them in the discussion area or send me an email. Thank you.